Hi, I'm Eden on behalf of Cityview TV, and we are here with Dr. Tom Gallaher. Dr. Gallaher, thank you so much for being with us today.
Thanks, Eden.
We're here to talk about breast augmentation. My first question would be, tell us a little bit more about breast augmentation.
Well, believe it or not, breast implants have been around for around 50 years. So within that time, breast augmentation has become one of, if not the most common, plastic surgery operations. And it has about as high a satisfaction rating as anything in plastic surgery. Believe it or not, over 300,000 women a year in the United States get breast implants. So it is a great procedure, been around a long time, and patients are generally very happy with it.
So I see that you have a couple of examples of implants that you brought with you. Could you give us an example of what you brought and tell us a little bit more about those implants?
So this is an example of a saline-filled implant, saline meaning salt water. The outer shell of the implant is made of silicone rubber. So the shell of the two different types or main types of implants are similar. The implant itself being filled with salt water or saline. The silicone gel version is a softer, more natural feel, and so therefore has become more popular over the last several years. There was a period of time when the only implant available for cosmetic surgery was saline filled, and the controversy took quite a while to resolve, but in essence, silicone gel implants are the most commonly used at this point.
Okay, and as far as selecting the correct implant for the patient, is that something that you do at the consultation?
So before a patient has one of these devices placed inside their body, it should be taken with a great deal of consideration and a very detailed consultation with a surgeon who can lead the patient through the process of selecting the implant that fits their goals.
And as far as the surgery itself, how long is the surgery?
So the average breast augmentation surgery for a primary, or the first set of implants that a person receives, is somewhere between 45 minutes and an hour under a general anesthetic so that the person's completely unaware and relaxed during the procedure itself.
Okay, and how long can do they need to take off from work?
So it depends on the person's job. The one restriction that's pretty steadfast for the first month after the surgery is no lifting beyond a certain amount. So depending on the person's job obligation, it can be as little as 5 days.
Okay, and as far as strenuous exercise, resuming workouts, busy schedules, swimming, everything like that, when can someone go back to all of those activities?
So unrestricted activity is typically at the end of a month or 28 days. Before that, the person is able to exercise. There are certain types of exercises that are okay and ones that we recommend that you reserve a bit. But that's another thing that the surgeon really needs to meet frequently with the patient, but both before and the immediate period after surgery, and long term for that matter, to coach them through each step, because every particular patient has a particular path for recovery. And so we need to really be involved with that individual and get them through that. But having said that, very quickly after surgery, resumption of almost unrestricted activity is expected.
Wonderful. If you are interested in scheduling a consultation, you can call Gallaher Plastic Surgery at 865-671-3888. Dr. Gallaher, thank you so much for being with us. Thank you so much for tuning in. We really appreciate it. Have a great night.